All right, everybody, let's get started. It's 11 o'clock and we want to get started right on time. Welcome all of you to the information session on the first ever Canadian Collaborative for Global Health, made possible by CanWaCH. Thank you so much for joining us all here today. Before we get right into the meat of the presentation, I would like to invite CanWaCH's Executive Director, Helen Scott, who's joined us here today to say a few quick words of welcome. Take it away, Helen.
Hi, good morning. I think this is the biggest webinar, or one of the biggest webinars we've had in a long time. So great to see everyone as I see your names flashing up on the screen. I also see a lot of really shy people who are opting to not have their video cameras on. I encourage you to turn your video camera on. It's always great to actually see the people who are meeting with us. So thanks, Jessica, for the introduction. As she mentioned, I'm the Executive Director of the Canadian Partnership for Women and Children's Health, and this little project has been a dream of many of ours for some time. We've been really excited and interested in the opportunity to work with Canadian research, academic, and university partners and with the NGO community to kind of look at what are the big data challenges out there and how can we leverage Canadian capacity to address some of those challenges. So really pleased to see your interest, and excuse my voice, I've picked up a bit of a summer cold, which is annoying this time of year. So I want to tell you just a little bit about CanWaCH to start with. The Canadian Partnership for Women and Children's Health is about 5 years old. But in its current form, we're only just brand new. So most of our team has joined us in the last year and a half. Previously, we were just a small coalition based out of University of British Columbia. And then in 2016, we actually received funding to incorporate and become our own not-for-profit, so an NGO. We have NGO status, and built a little bit of a team with support from Global Affairs Canada. Our work focuses on 3 strategic pillars. So the first is measuring results. This is the work that we do around looking at how can we work with the Canadian global health community to improve and build on their capacity to do gold standard measuring results, to really understand what is the work that's happening in Canada, Canadian programs are delivering, what's being effective, what's not working, how do we drive policies based on the data that we have for decision making. So that's the pillar under which this collaborative is falling, the measuring results pillar. Under that pillar, we're also building a Project Explorer. We've built and launched a Project Explorer, which we're refining with 2 paths. And I see Tracy on the call. Hi, Tracy. This is, if you take a look at our website, you'll see the map of all of the projects that we know of that are currently being executed around the world in women and children's health. What you may or may not be aware of is the background behind that map allows us to look at descriptions of the projects, exactly where they are, that the project is either expecting to achieve or has already achieved, the nature of the funding for those projects. And we've actually piloted a project in Haiti where we brought together all of the Canadian partners, organizations who are working in Haiti on health programming, and have brought them together in person once in Canada. They've met once in Haiti. They've met by GLIP many times, and they're actually meeting next week. So the Haiti project is a bit of a pilot for us around how can we enhance our collaboration. The second strategic pillar is knowledge exchange. So we look to create a platform for experts in different areas to share their knowledge with each other, and that's across sectors. So from the academic sector, the medical community, and the NGO sector to share information. And then our last strategic pillar is stakeholder engagement. So that has 2 components. The first is communications, and CanWaCH is working with our over 100 partners to launch a Lead On Canada campaign. The objective of that campaign is to let Canadians know about the tremendous work that our partners do around the world to improve the lives of women and children. And under stakeholder engagement, the second component is our sort of policy advocacy work. So working closely with Global Affairs Canada, with Health Canada to look at Canada's global leadership role in health and how we can make sure that we're working really well with the government to deliver the best programs and the best work that we can do. So we're really looking forward to working more closely with the universities. I think if I look back over the last 5 years, I would say one of the biggest gaps of our organization has been in really building the strategic partnerships and creating the community around the universities around global health. Delighted to see Charles Larson here from the Canadian Coalition on Global Health Research. He's certainly been a good partner of ours and has lent a lot of expertise, his own expertise, to us to think through, how can we take some of the learnings from his program and apply them to the women and children's health world. So that's kind of a CanWaCH in a nutshell, a bit of a long elevator pitch, but it gives you a sense of who we are and how excited we are about launching this opportunity. Back to you, Jessica.
Great. Thank you so much, Helen. So hopefully you're all heard of lots of different ways that you can get involved with the exciting work that CanWaCH is doing. And one of these key ways is through this collaborative that I'm so excited to talk to you about. Before we dive right into that discussion, I do want to give a very quick overview to Zoom. I'm sure many of you are familiar with it, but it's always good to make sure that we're all familiar with how it works. So down in the bottom left corner of your screen, you will see a microphone. It should have a red line through it for most of you, which means that you're currently on mute. To ask questions, you simply press that button to unmute yourself and start talking. We would ask that throughout the webinar, just because we are expecting a fair number of people, and there can be a lot of background noise, for you to keep that on mute if you can. But as we go through the presentation, this is a discussion. And as I'll say when I go through the agenda, there's definitely a dedicated time for questions and answers, but please feel free to ask a question at any time that you have one. Another way that you can ask a question is through our chat. So again, looking down at the bottom of your screen, to the right of the small green icon, you should see a speech bubble that says chat. When you click on that, it'll open a panel to the side. And there you can direct your questions to anybody, to the room at large, or to me directly. As well, my colleague Melody, the name Melody Tondeur, you'll see it there. She's agreed to help with some technical support. So if your microphone isn't working, or you're having some difficulty, please feel free to message her, and she can help you out with that as well. And then, as Helen said, to the right of the mute icon, you'll see the ability to stop and start your video. I see many of you have turned your video on, and that is wonderful. For the discussion portion, we'll make it so that you can see everybody. But if you go up to the top right of your screen, you'll see the option for speaker view or gallery view. Speaker view means you'll just see me because I'm talking, and I'll fill your screen with my beautiful face. Or you can go to gallery view and see everybody's beautiful face as a collective. However, for most of this, I do have a PowerPoint just so that there's some text there for us to take a look at, and you can and that will fill your screen as well. The last thing I'll say before we get started is right up at the top of the chat. You may have to scroll through if there's been a few comments so far, but you'll see a link available to our website, canwatch.ca/articles, and then it links to the Canadian Collaborative for Global Health. There you're going to find links to our website to all the documents that I'll be discussing today. So if you don't have those open with you, then you can click on those now, and we'll get started. So with that, I'm going to just quickly share my screen, and we'll jump right into the conversation. Wonderful. Could I, Helen, I see you in my screen. Could I get a thumbs up from you if you can see my screen, please? Oh, beautiful. Thank you so much. All right. So perfect. So Helen has just provided you with a great overview of CanWaCH, and I've shared with you a link to where on the website you can find the details of what we'll be discussing, but I haven't told you who I am. So for those of you who I haven't yet had the chance to meet, my name is Jessica Fern, and I am the Manager of Global Health Impact here at CanWaCH. And what that means is that I sit on the team, on the pillar of work that Helen mentioned, that really focuses on data and monitoring, evaluation, and measurement. Really exciting stuff, if you ask me. I think I've got the best job at CanWaCH, although other people might argue. So I'm really excited to be focusing on this specific project, and it will be me with whom you'll be having most of the conversations about any questions that you have relating to the project. And that's my email address there. When you received the invite, you would also see it there. So please feel free to jot that down and be in touch with me. So for today, we've just done a welcome and orientation. I will be going a bit through the background of the collaborative. A lot of this will be available in the call for proposals, but I do think it's helpful for everyone here to understand why we're doing what we're doing, and to give that framing for the submissions. We'll be talking specifically about the call for proposals, what we're asking for, and I'll provide you with some answers to the questions that I've been asked to date, and then and some tips and recommendations for things that would be helpful to think about as you're preparing your proposals. We'll open it up to a broader discussion, and then finally we'll close with a discussion on how to facilitate partnerships. We're really interested in supporting all of you. Many of you already have great partnerships, but we want to support all of you in forming the fantastic partnerships that you might need to be successful. And I'll tell you a little bit about how we'll support that towards the end of the discussion. And I will endeavor my very best to end right on time. Unfortunately, I can't see the chat when my thing is in full screen. So again, if at any point you don't understand something, please feel free to just directly unmute yourself and ask the question. So that I can hear you, or else pose it in the chat if you can't, and Melody will make sure that she stops me to ask. So how did this collaborative come to be? Well, the concept of the collaborative was born out of a recognition that the coming few years present a really key opportunity for our sector as a whole. In Canada, we have had the emergence of the Feminist International Assistance Policy. Globally, we've set ourselves the Sustainable Development Goals, the SDGs, and we're coming up on that critical decade, some have called it, the 2020 to 2030, to really achieve those goals. But we're also at a really exciting time where we've got a recognition of the importance of evidence-based decision-making. And we also have a government and a Canadian public who is very interested in issues relating to gender equality and health for all. So this is a really exciting time to be tackling these global goals, and specifically for Canada and Canadians to play a key role in that. So as Helen has mentioned, we've been around in various forms for quite some time, and particularly over the last couple of years. We have had various events, our annual general meetings, our conferences, working with our working groups, and through these different consultations, CanWaCH has been specifically looking at, okay, these are all the enabling factors, but what are the barriers? And what we heard time and time again came back to critical data challenges. There's many challenges, but we kept hearing three key challenges as regards to data and measurement. These were that there still continue to be gaps in what we know and in how we collect information, and in particular in regards to humanitarian contexts with specific communities, and with measuring results or outcomes, particularly in those contexts or with those communities. Where we do have data or tools, those resources can sometimes be inaccessible to the communities that need them or to us, or they may go unused as a result. And then finally, even when we have the best of all of these situations, there is a perception that there may be a lack of capacity, and that could be due to limited resources, that could be due to staff turnover and change, that can be for a variety of factors. But all of these things are working together to create an environment that isn't setting us up for the kind of success that we need to have in order to achieve our global goals. So in thinking about the role that we as a membership organization would play in this, CanWaCH believes that we need to invest in interdisciplinary solutions to meet these challenges, and that our work in global health and our work in gender equality are fundamentally intertwined. So with support from Global Affairs, we decided to use the next 2 years, the 2 years leading up to that critical decade, to launch the first Canadian Collaborative for Global Health. You'll hear me call it just the Collaborative for short, to generate solutions to these urgent data challenges. And all of the work that we will do will be rooted in a feminist approach and a feminist way of working. So in the document, you will see that the collaborative has 3 core objectives, and tried to make them somewhat alliterative to make them memorable. These objectives are to investigate underlying barriers to effective data progress, to then incubate useful solutions and quality partnerships to address these challenges, and then finally to inspire, to entrain, to build the capacity of the next generation of Canadian leadership in these issues. And through our work in tackling these 3 things together, not in isolation, we believe that this will result in improved understanding of what the barriers are, not just in collection, but in analysis, utilization, and communication of data. We believe that it will lead to increased availability of solutions that are accessible, but also the quality partnerships, these interdisciplinary partnerships that are needed to break up silos and really make progress. And then finally, the enhanced capacity, not just of the research community, not just of the civil society community, not just of our in-country leaders, but all of us together to do our work more effectively. So this very fancy diagram is, I hope, maybe a visual way to kind of to communicate that. We have these 3 core concepts of investigate, incubate, and inspire. And we believe that when those 3 things, when we invest in those 3 things, we will create an enabling environment that will help us to achieve our global goals. So it's a simple pathway, but we believe it will give exceptional results. But we do not want to perpetuate that kind of traditional model of supporting solutions that reinforces silos. So this is something that I want to stress that I think is a bit unique about the collaborative model and will be important for those who want to be a part of it. So you'll see again another very fancy diagram that kind of has a bit of a hub and spoke approach. So at the center we have the concept of the collaborative, and then the individual labs, what we're calling labs, are the projects or the proposals that you and your teams are putting forward. But we, as part of our commitment to a fundamentally feminist approach, we don't just want to have a one-way relationship between us and the labs, but rather have all of us working together. This will, I'll talk a bit more about what this will look like, but in brief, what that will mean is that we will learn from and share with each other. There'll be opportunities for all of the labs that are supported to come together regularly to talk about the challenges that they're facing and to learn from each other. And everything that we do will be anchored in these 4 concepts of feminist learning, which really look to you, all of you on this call who are the experts in what you do, to create a brilliant solution that will have significant capacity to make a lot of change. So now let's move on to the request for proposals specifically and what it involves. Again, if you look at the document that's in the link that I shared with you, you'll see that there are 3 key outputs that are expected from each lab. I won't go over in detail the questions that we ask because those are in the RFP unless you'd like to discuss those. But in brief, we expect that each lab will be doing at least these 3 things. One is what we're calling the investigative inquiry. That's really making sure that we fully understand the scope and scale of the challenges. Now, a lot of you will already have done a good deal of this work by virtue of putting in the proposal. You understand the issue that you're dealing with pretty well. That's why you've come up with a solution. At the same time, we recognize that there's not always the opportunity to really invest in understanding the full scope of what's out there. And that can sometimes lead to duplication or confusion. So within the project itself, we have dedicated opportunity for you to really explore what else has been done, who else can we learn from, how do we really understand the challenge and the solution that we're putting forward. The second output, of course, will be what we're calling the solution, which is a deliberately open-ended term, and I'll talk about that in a second. And this will, of course, be the core of the work that you'll do, which is piloting or scaling the solution that you want to bring forward, whether it's something new or whether it's building on work that you and your teams have already done. And then last but never least is the focus on building capacity. This can include everything from taking the solution and teaching people how to use it, to creating lasting ways of communicating, to promoting what you've come up with to a larger community or context. All of these things will look very different depending on your individual proposal, and we are expecting really unique and individual responses to each of these, and that's all right. But we're generally looking for that trajectory of in-depth understanding, work on the solution, and then communicating and sharing what you've learned so that others can benefit. A few key things to note. It does say in the RFP, but I want to highlight, solutions may, but do not necessarily have to, involve the creation of an entirely new approach. So it may be that you want to pilot something that has never been done before, that does not exist, that you've been working on or want to bring to life, and that's wonderful. It may be that you're building on other work that's been done to date by you or others. That is also all right. We'll talk a little bit in the selection criteria about that, but really we're quite open to whatever is likely to have the greatest impact. I also want to underscore that all proposals must demonstrate a strong understanding of gender equality. Again, what that looks like in your individual projects will be unique. The point, though, is to make sure that we're not just separating the concepts of global health and gender equality, but we're really looking to be quite explicit in understanding how gender transformative approaches are realized in the work that you're doing, how gender affects the work that you're doing, and a recognition from you on how you're reflecting that in the work that you're doing. So one of the big questions that we've been asked is, of course, so what exactly should we focus on? You'll notice when you read the RFP that it's quite open-ended in regards to that. And that is a deliberate choice. In order to model the value of co-creation and community driven solutions, we recognize that commitment requires that we look to you, the experts and leaders in what you do, to tell us what the critical challenges are and what the best solution is. Now, based on the consultations that I talked about and the work that we've done, several what we call the topics of interest have emerged. And these are things that we know tend to be the challenges that a lot of us are grappling with. These are some of the things that I alluded to before, working with specific gaps in understanding around specific communities, tracking outcomes in challenging contexts or in short time frames, not just collecting data, but making that data used and accessible by those who need it to drive change. Not always the end of an evaluation, but planning at the beginning in the ways in which models can affect programming, development of indicators. All of these things are pressing, and we know that these are some of the big challenges. But we expect that many of you will be working in areas that relate to this. But we want to reassure you and reaffirm that we really want to understand from you what the true challenge is and why the solution that you're putting forward has the potential for impact that it does.
Jessica, sorry to interrupt.
Please.
Yes, so I just wanted to confirm that you are recording the webinar because a few people are unable to join.
Oh my gosh, I didn't even say that at the beginning, did I? Thank you, Melody. I didn't say that. So yes, this webinar is being recorded. I did note that in the message to people, but I didn't say it at the top of the webinar, so my apologies. Yes, this webinar is being recorded, and it will be made available at the end. I'm going to try my best to get it out very shortly. We are also doing another webinar at 1 p.m. today in French, so it will be available in both languages for your reference. Thank you. We recognize again that there's value to solutions that have broad applicability, and there's values to solutions that are quite contextual and can have a huge impact in a very specific context. We don't necessarily require one or the other. That being said, we do have a relatively short time frame, and this is the first project of its kind. So we are going to be looking for places where we think that investing in those solutions can benefit a great number of Canadians in a meaningful way. So we will be particularly encouraging submissions that test solutions in geographic regions where Canada has made major investments, just because there's enough of a massive of Canadian investment in those areas to test and pilot and learn. We're looking for submissions that propose solutions for work in fragile contexts or humanitarian settings because of the significant gaps that have been identified there, as well as those that focus on topics where Canada has demonstrated expertise and extensive programming. So that could be, for example, SRHR, sexual and reproductive health and rights, early adolescent health, work with refugees, and on and on. There's many different ways that can be understood. So if your work fits into that, please feel free to make it explicit, but know that that's not a necessary exclusionary criteria for the work that you're doing.
Jessica?
Yes.
Is it a good time to ask a question on the slide that you just showed, or is it better to wait until the end?
No, ask a question whenever you have it.
I had a specific question on the geographic regions where Canada has made major investments. Are you expecting to share a specific list of countries? There is anything we could ask more to understand better where are the preferences in this case?
Right, so I very much do not want to, I think we all know that it's important to move away from priority countries in the sense of, only focusing on particular areas, because the whole point of this is to address gaps. So what we mean in this is that, we know that Canada, for example, has made significant investments in Haiti. I'll use that as an example since Helen raised it at the top of the call. We have some significant investments and a lot of partners working there. So if we know that there's a great body of work that's happening there, and this is a solution that would be quite relevant and useful, then we could feel reassured that quite a lot of Canadians would benefit from it. And many of you know what those areas of investment are. You've seen the calls for proposals come out from Global Affairs, and you can also reference our Project Explorer on our website where you can see where a lot of investments have been made. But that being said, I really want to underscore that there is no priority list of countries. There are no countries that are not eligible. We recognize that, for example, if you're working in a particular context or with a particular community, you might work in a wide range of countries when you're piloting a solution, or your work may not necessarily be geographically defined, again, depending on what you're doing. So just recognize if that is something, we want to call attention to it, but there is no list of required countries or preferred countries for work.
Thank you. Thank you very much.
No, thank you. So in terms of just a rough timeline first for just the submission of the RFP, we opened the call for proposals on May the 16th, and we would like to plan to close the call for proposals on June 28th, Thursday, June 28th. We recognize that's a pretty tight timeline, but as you will soon see, we're really trying to get this up and running very soon, and hopefully that's ultimately something that you all feel as well. You'll note here I've listed a deadline of June the 22nd for written questions. That's just so that I can reasonably get back to you in time, because that last week I'll be getting a lot of proposals and I just can't guarantee that I'd be able to respond to everything. So please, if you have specific written questions, please try to get them to me by Friday the 22nd of June at my email, and I will get back to you. Once the call for proposal closes, we plan to use July, the month of July, to have proposals reviewed by the selection committee. It will not just be me, it will not just be CanWaCH, but rather a selection committee comprised of diverse individuals who have expertise in a lot of these data challenges, who will be reviewing and ultimately selecting the proposals. I'll talk about selection criteria in a minute. We want to be, you will hear from us. Our plan is that you'll hear from us by the end of July so that we can spend August in discussions with you around contracts and getting everything settled. I'm saying that so that it will happen, but in the summer it is really when we'll be having those conversations, because our desire is to actually start all of the programs of work by the beginning of September. So again, a tight turnaround for the proposal, but you'll also get a tight turnaround in terms of a response, which hopefully will help you with your planning and conversations with your partners. So as I said, the request for proposals will be due 5 p.m. Eastern time, so close of business Eastern time on Thursday the 28th. Proposals are submitted to me via email. You can send them in multiple attachments if you need to. If you need to send them in a zip file, that's fine. If you're struggling with that and we need to find another way for you to submit it, it's no problem. It's to me that it's coming, so we can discuss that. If you do send multiple files, please just note your organization name in the subject line, please, so that I can keep everything together and follow up if need be. And you will see when you go to the link on our website, there is a submission checklist document. In that document, there's a handy reference guide for everything that we would like to see included, as well as your contact information for the lead person with whom I will be in contact. Please include that with your submission so that I can follow up with the right person if we're having any difficulties. You will see that there is a submission details document as well that provides you with everything you need to know about the actual proposal. So just really briefly, 12 pages maximum for the core content. You don't have to hit 12 pages if you don't want to, or don't need to rather. And then any appendices, which includes the budget and other things like that, would be in addition to that. And in terms of budget, you can be more than or you can be less than this amount, but we are, to give people a general sense, we are encouraging people to budget for about $700,000 over a 2-year period. Again, you can go for more, you can go for less as you need to. But generally that's the ballpark that we're thinking. So you can keep that in mind when you're preparing your proposals. And again, that can be in a separate Excel document if you would like. So in terms of the selection process, another area that's mentioned that we will give a little bit of preference to because of the short timeline is those organizations who clearly indicate that they have structures in place to do this work. So by that I mean that there are, some staff or some capacity in place kind of ready to go. That doesn't mean that you can't hire for roles in this project. We assume that many of you will, but we will be looking to understand how long it might take you to get this work up and off the ground, because we only have a 2-year window. So please, in your proposals, make that quite explicit as to any challenges that you foresee with that, and what resources you have on hand to begin whatever components of the work you'll be beginning with. I also want to draw your attention, so in the submission details document, you'll see a list of 9 criteria, but I want to draw your attention to the fact that the first 3 criteria total 50% of how we will be reviewing proposals. And so those are, of course, the key ones to focus on. As I said before, things do not necessarily need to be entirely new, but we are going to look for a solution, we are going to be looking for a solution that represents what we're calling a, quote, more than incremental improvement over existing solutions. So where relevant, contextualizing the solution that you have with what exists already will be helpful for our understanding. We'll also be looking for the capacity. This is what I was speaking to about who you've got on your team to deliver on the work that you're talking about. And we also want to see the nature of the partnership. In some cases, you'll be submitting for partnerships that you've worked on in the past or worked together in the past. Let us know that. If this is an entirely new partnership, tell us about how you've come to be and how you plan to work together. Bear in mind that we don't expect that every single partner in a partnership contributes equally in terms of financial contribution or human resources. We're looking for the right people to come together in the right way. So you tell us what that is, but just help us to understand who's on the team and who's making sure that work is going to happen. A high-level timeline for what we're thinking of for the collaborative as a whole is, as I said, we ideally want to kickstart September of 2018. There'll be a kickoff meeting where we'll bring everybody, all the successful labs together to kind of get started on the work. We'll be checking in around the midpoint in June. You'll notice that this aligns with Women Deliver, and we'll be thinking a little bit more about that, but that's our current plan. And then concluding in the latter half of 2020, in addition to having opportunities to share and disseminate the work that we do, and this will be refined once we know who the labs are. Please note that and it says this in the document, that you do not need to budget for attending these annual meetings. We have budgeted for that separately in terms of, for example, travel that might be required for members of your team to join annual meetings. So you don't have to worry about forecasting or estimating that in your budgets. As it says in the document, all the labs, these are required meetings. Not everybody, of course, in your team will have to go, but ideally we would have at least one person representing your lab at each of those annual meetings. You'll be having regular contact with me. I promise you I'm very nice and really excited about this initiative. So we'll be finding regular moments to touch base just very briefly each quarter so that you can quickly let me know how things are going. And it really will be a casual chat. We are requiring that everybody, all the successful labs, include their project information on the Project Explorer, and that fundamentally this is a project about being open source and about sharing. So whatever solution that you put forward, we expect that you are open to making these solutions available to the Canadian and global community for everyone's use. And again, we will look at each individual lab and what that involves and have those conversations with you, but that's the core spirit of what we're trying to do. So let's go into just some quick questions that I've heard from some of you, and then we'll make sure to have enough time for discussion. So a couple of quick questions that I've heard a lot about has to do with eligibility. So can non-Canadian based organizations apply? And also you'll see that there's a requirement for one civil society and one research institutional partner, both of whom must be Canadian at a minimum. So people have asked, can non-civil society or can non-research organizations apply? And the answer to that is, of course. Labs are, we expect that they will be comprised of a multitude of different organizations. You do have to have the one Canadian research and the one Canadian CSO partner, but you can add as many other partners to that as you would like. And as I said, they don't all need to be contributing in the same way. We do want to see diverse quality partnerships, and we're looking to create the sorts of partnerships that will set us up for success in that critical decade. So feel free to bring anybody onto that team that you need to. If that's who you are and you don't yet have partners, I'll talk towards the end about how we can support you with some of that. Another question I heard is from those organizations that do both research work and also work that would be classified as a CSO. So how would you classify yourself? And so what we have been saying is that we encourage applicants to refer to whether it be their charitable objects or their articles of incorporation, to look at what you as an agency are primarily mandated to do, and how you would classify yourself. And then in the proposal, be clear about what the role is that you'll be playing in the partnership. Really what we're looking for at the core of this is partners, proposals that foster a complementary and interdisciplinary partnership that brings the perspective of researchers and civil society. So if you can show us how that is happening, then you will be achieving that goal. And then finally, do all of our partnerships have to be finalized, confirmed with a contract before you submit? No. We are going to be looking to see that the two required partners have something, that you've committed to doing this. But we recognize that some relationships will build over time, and you'll, build other conversations as you go. That's okay. It's fine to say, here's who we plan to work with or who we'll be reaching out to, and tell us about the nature of any conversations to date, but you don't need to have every single partnership locked and set in stone. Some other questions that have come up that are more administrative in nature. One of them is in the budget, it refers to essential project personnel. And I've had people say, well, like, who is essential? Who counts under that? So essential personnel for us refers to anyone who directly supports the work or the administration of the lab. So that could include research assistants, program managers, finance clerks, in-country data experts, technical leaders, basically anybody who is directly connected to the success of your work. They can be Canadian, they can be non-Canadian. However, the key here is that we can't accept an administrative percentage, like a lump sum administrative percentage. So what we will need is for anybody that you're billing under the lab, please provide the amount, the actual dollar value that individual will be paid under those salary lines. The biggest question, of course, is you'll note that there's a line under the personnel that says, talks about secondment. And so I've gotten quite a few questions about, okay, well, what exactly does that mean? Because that language isn't particularly familiar. Well, at this time, it is a requirement for CanWaCH through Global Affairs that anyone remunerated through the lab has a secondment contract with us. However, to clarify, the lab itself will be paying out the funds to those individuals. You will be responsible for managing, hiring, supporting, paying your staff. The secondment agreement will be with the partner organization. This is a way that we've worked in the past with other university partners. It's worked very well. And I've received a template contract that I'll be making available in the list of resources on the website. I will make it available there for you all to take a look at. Every individual contract will be different, but I'm hoping that will help a lot with the specificity of that. As I said, where will the staff be based? Some people wondered if secondment meant that they had to come work at CanWaCH. There is no brick and mortar office for CanWaCH, so there'd be nowhere for you to go. But no, all the staff are based in your institutions, in the same places that they work, whether in Canada or abroad. And then another final question I've been asked is, can this work occur alongside another project? And the answer to that is yes, it can. And that's not an issue at all. So if you've got other funding or work that's going on, just let us know where this fits into the work that you're doing. But absolutely, that's not an issue. Before we move into the discussion, I want to just highlight a few final recommendations based on some conversations I had with folks that might be helpful in preparing a successful proposal. The biggest one, of course, is, and hopefully we have made it clear in the documents that we have, the focus here is really on a data challenge and a solution to that challenge. So we recognize that many of you, especially our CSO partners, might have other work that you're doing on an ongoing basis, which is wonderful. But this is really about the solution. So when thinking about where to focus your time and attention, focusing it on what the challenge is and what your solution is and what the potential for impact is where we want the attention to be, as opposed to maybe the broader context of the programming that you're doing and the services that you're providing. And all the funds for the collaborative are specifically relating to data challenges, which is something unique and special. So we'd like to keep them focused there. We encourage you to highlight the gender transformative approaches and potential of your work, as I've talked about. Making sure that there's a clear timeline for the work that you plan to do over that 24-month period, and helping us to understand kind of the risks associated with that. And then I also really want to highlight the capacity building element of this. A lot of times that might be seen as kind of the afterthought, or the, you know, and then we will, you know, something very simple like, we're going to do this great work and then we'll, you know, write a paper on it. That's also good and could be a great element if that's what's appropriate. But we encourage you to really think about that as a really pivotal way that you can better support your own work, support the work of others, help people to learn, share capacity between Canada and our global partners. This, I think, is really exciting and could be a really fantastic opportunity for your organizations and for the collaborative as a whole. So please don't shortchange that section, but give it a lot of time and focus. Okay, so I'm going to quickly stop sharing my screen. Before we wrap up, I will talk about facilitating partnerships. But I'm going to quickly do a stop share now and say, while I take a breath, does anybody have any questions that I didn't cover or things that you'd like to see clarified?
Yes, I have a question.
Please go ahead.
Yeah. My name is Sri Murray. I'm speaking from Memorial University. Obviously, the presentation had many aspects, but there are two things which puzzled me a little bit. One of them is the use of the word lab in your collaborative, because it is not typically a term that you would use in the context of doing social sciences research. However, so that is, it's a choice that you people have made, and I wanted to understand a little bit as to why the term lab has been used as opposed to another term that might be more descriptive of the kind of collaboration that has to be forged. The second question is really, I mean, there are other questions, but I think that in your statement you said that people could work on a project alongside. It is certainly permitted within the context of this particular project. But as you know, there have been a couple of initiatives which could be considered to be similar. One of them is the call that was put out not too long ago, Her Voice, Her Choice, by the Google Affairs. And there are obviously not everybody is going to succeed in that. So there have been certain partnerships which have been forged. So do you see that as one possibility that could be used in this context? And again, in terms of staffing, is there possibility of purchasing services? Because there's a big focus on data gaps and data collection. And so there is need for expertise in terms of data analysis. So is there room for hiring a data analyst? Is there a possibility of purchasing these services from somebody who offers them within the university context?
Great, thank you. I also see that there's a question in the chat about submitting more than one proposal. And Tees, I see that you wanted to ask a question. Can I take that one? And then I'll answer them all together. Tees, go ahead.
Okay. Let me switch on my video, otherwise Helen blasts me.
Absolutely. So fun to see everybody.
Thanks very much. I think that is a very clear overview, and also I think the proposal is quite clear and very broad. I just wanted to follow up on one thing that you explained in response to the questions about this contract. Mm-hmm. Explained a little bit on how it can be done, but I'm not familiar with this kind of arrangement. But what is actually the purpose of that kind of arrangement? Apart from that, GAC wants you to do it, I don't see what the advantages of doing that.
Absolutely. And then Alessandra, you said you had some questions. Please go ahead.
Yes. Thank you. The first question is related to the nationality of, or the fact that the research institute or the CSO needs to be Canadian. By reading the information that you shared, my initial understanding was that at least one of the organization involved in the project needed to be Canadian, but not all of them. Is that correct? Or I misread the information? And in this case, if you can specify a little bit more about this. And the second question is related to the number of proposals that can be submitted. If we identify more than one gap that we believe is important for CanWaCH and GAC to look into it, and the same organization will partner with different partners to address those different challenges, is this something that you would appreciate, or you would prefer to have only one proposal with one selected challenge? Thank you.
Great. Well, let's start with these, and then we'll go from there. And before I begin with all of this, I want to say that we will. I am compiling a written response to these and all of the questions that will go up on the website this week. So if you have other questions and we don't get to them, you just send me an email, and we'll include them in the written list. So this is not your only time for questions. Okay, so let me make sure I try to tackle all of these. Let's start with the idea of why is it called a lab? Well, we came up with the term collaborative to really underscore the way in which we wanted to work and our commitment to that community-based way of working. It just kind of was a bit catchy to me to call it a collaborative, because we would have a variety of labs that would be collaborating, and also to recognize that in some cases we will be generating new ideas, new ways of working, new cooks in the kitchen, so to speak. We're really interested in different types of partnerships, and we're looking for something that really captured the creative and investigative spirit of what it is we're trying to do, that also underscored the idea of working together, sharing, and mutually supporting each other. That being said, I would absolutely love to have a conversation with people like yourself, who have that social sciences background and could maybe help us find all the variety of ways in which we'll communicate the work that we're doing. And I think that once we have all of our labs selected, it will be really interesting to see how they will work together, and to talk a bit about how to communicate that effectively for different audiences. When you asked about Her Voice, Her Choice and the partnerships that were formed there, if I understood the question correctly, it was if people have formed partnerships to apply to opportunities like Her Voice, Her Choice, could those same partnerships then apply for work in a lab? The answer to that is absolutely they could. Any existing partnerships that are out there, you're welcome to submit to them. Her Voice, Her Choice does focus specifically on sexual and reproductive health and rights. And that is a topic that we are certainly very interested in because of course, there's been some major investments in SRHR, but that is not the only topic that people can explore. So we are quite distinct in that way. But however you formed partnerships, and if you're building on that work, that's fantastic. To the idea of can you submit more than one proposal? So we would ask that so whenever a lab submits, there is a lead applicant. That is the organization with whom CanWaCH would have the contract, who will be responsible for the core of the reporting in the same way that it works with Global Affairs or really any other funder. We would ask that only one organization occupy that role per lab. So if you are occupying that role in this one lab, we would ask that you not be a lead on another proposal. That doesn't mean that you can't be a part of other proposals. So absolutely, if there's a role for you to play in different areas, you're welcome to do that. We wouldn't want to impede that, but we would ask that only one organization be a lead applicant one time. And in terms of Can you hire somebody to support, let's say, data analysis? Yes, absolutely. So we recognize that there will be some resources that you already have in place in your organization. You may need to recruit more. That's totally fine. And a data analyst would absolutely be a reasonable expense. Just include the amount that you would be paying that person in the budget that you submit. To the question about what is the purpose of the secondment contract beyond the fact that Global Affairs requires it, it is the nature of how we work with Global Affairs that we cannot just flow through funds in a particular way. So this contract setup is designed to make that clear. Our goal is to make it as non-burdensome as possible. And in the past, when we've worked with other partners, for example, universities, it's been very straightforward. So again, I'm hoping that making that example contract clear will be helpful. But please know that our commitment at CanWaCH is to make this as not burdensome and as clear as possible. Your staff will not be getting paid by two different people. All the funding will still go through that lab to be administered on those expenses. And then finally, to the nationality question, and we had a couple of others. So to the nationality question, there is a requirement for one Canadian CSO and one Canadian academic researcher. As long as you have those two, you can have anybody else from any other country that you want, which could include CSOs that are not Canadian. So as long as there is on that team, let's say you got a team of 5, as long as 2 of them, one is a Canadian CSO and one's a Canadian academic, the other 3 can be literally anybody else that you want from anywhere else that you want. So that's the only piece that we're looking for. That requirement only applies to those 2, but we do want to see Canadian researchers and Canadian civil society represented in that. And then I see a couple of other questions that I'll get to quickly because I want to take 2 seconds at the end to talk about partnerships. One of them is, does the proposal define data to include approaches that gather and analyze qualitative data? Yes, absolutely. Qualitative and quantitative are eligible within this and certainly encouraged. I believe we asked the question about different types of partnership. I'll get to that in a second. Is the focus on data utilization instead of or in addition to data collection? Yes, absolutely. The focus can be on not just collecting data, but using it more effectively, getting it to those people who could use it to make meaningful change. That is absolutely acceptable. Can consultants be a part of the budget? For example, technical activities like web design? Yes, they can. That's allowable. Please put that in the budget. In the last 3 minutes, I do want to talk quickly about partnerships. So please either continue to put your questions in the chat so that I can follow up with them or send them to me via email. But I do want to talk about one other really important thing. So at the top of the chat, or linked to on our webpage, you will see a link to a Google spreadsheet that we've created. Some of you already have partnerships, but some of you have said, well, how can we get connected with different organizations that maybe are working in what we're doing, or that we could work together to amplify or bring our different pieces together in a unified whole. Partnerships can look different in different ways. So to help with that, we've created a Google spreadsheet. Please note that the sheet is open access, so anybody with the link can view it. So bear that in mind when you're putting information in there. But we've put it there for you. So please go in. If you're open to talking to other people or want to work with other people, you can make a note of that, your contact information and the kind of work that you're thinking of or where you're thinking of working. And if you put your information in that document, it's presumed that you're open to people reaching out to you to talk to you about it. So please use it if that's you. Or if you just want to talk and coordinate proposals, we've tried to facilitate that as easily as we can. The other option for you, which could be a bit slower, but it's available to you too, is to reach out to me. Let me know if there's specifically people that you might want to connect with, and I'll see what I can do. But I'm hoping that this will make it a little bit easier. You'll also see tab 2 of that document is a resources tab, and I'll continue to add to that so that you always know where to go. You can just bookmark that page if you want, and you can always go there to find other resources that we come up with as time goes on. And as I said, please contact me for more information at any time so that I can help you with that. And if you have
I wanted to add, Jessica, that the spreadsheet is for both on the same spreadsheet for the organizations working in French and English. It's in the same spreadsheet.
That's right. Yes, absolutely. So when we have this conversation in a couple of hours, we'll be telling our Francophone colleagues to post there as well. So hopefully we'll get the widest range possible. And one thing I haven't said, although it's in the document, but I will make it explicit, is that this call is open to members and non-members of CanWaCH. So of course we encourage our members to apply. We would love to have you apply, but you do not need to be a member of CanWaCH to apply for this opportunity. Oh, no. I didn't want to take you there, although it is a great spreadsheet. With that, all that remains for me to say is to thank all of you for your interest in this opportunity. If I've been able to convey anything, I hope it is my enthusiasm for this project. We're gonna learn together, and we're going to build it together. But I think this is a really precious opportunity to invest in issues relating to data that have challenged us all, and which so often there are not resources for. So I'm thrilled that CanWaCH can be a part of that, and that we can root this in a rights-based approach and a collaborative way of working. So please don't forget to fill out that form. Let me know if I can help you. This is my email. Please be in touch at any time to discuss your questions. Thank you so much for taking the time to speak with us today, and best of luck. I hope to get proposals from each and every one of you. Thanks very much, and have a great rest of your day.